Tom and Henry, 1 minute each. What would be the 2 or 3 things on your what next agenda?
Steve,
Tom?
let me just say, I think we know we have 3 big problems. We have an access problem that we addressed. We have a cost problem that we've talked about. We have a real quality problem. This is legislation that is designed to address all 3, although the insurance side, the access, has gotten the bulk of the attention in the first 5 years.
A couple of other legs out.
Now we're going to move on to payment reform, to deal with cost, moving off of fee-for-service, coming up with innovative new ways to address cost and control it a lot more effectively.
What people are getting.
And then to delivery reform, to address quality. We still have a mess out there in measuring quality. We've got to figure out, if we're going to really talk about value, we've got to find ways to be able to measure quality to assess value. And that's something that you're going to see a lot more of as we go forward. We're going to have new tools to do that. There are 2 driving forces, policy and technology.
Right.
Policy and technology married together will help us address all of those challenges in the coming years.
Henry?
All of the things that Tom Daschle just outlined as to what we need to do, the administration can do without Congress. Because demonstration projects were written into the bill, different models could be tried, and so we're going to see things develop without Congress passing any new laws. And I think people are going to be cognizant of the fact that while some people would have said, if we're going to redo the health insurance in this country, why not take the model that most other countries have, which is a single payer, the Medicare model? The reason we didn't is because the president tried to get Republicans and Democrats to work together, so that he chose the Republican model that was put forward against the Clinton healthcare bill, which was private insurance companies competing with each other in a marketplace where the consumer can make a choice. So he made this as modest and bipartisan as he could. The Republicans chose, notwithstanding enormous efforts, not to be part of it. What can we change legislatively? I think we have to do what we can to get the states to pick up the Medicaid option. It's ridiculous that they haven't. It's free money that helps their health care providers, millions of people who are uninsured. It would help the economy of those states. And notwithstanding that, governors and legislators are saying, oh, we don't want that, because they're indifferent to the consequences of it. We need to get the Medicaid part fixed. Pharma got too good a deal in this bill, and we need to go back and correct some of those problems. But even after we correct those problems, the big cost driver that we're now facing is the rising cost of prescription drugs. We have to come to terms with that.
Right.
And I think we have a law in place that is a success, and we need to work around it. But I think the posturing politically will go on, but we can now work for bipartisan efforts in the future where Congress will have a role, especially in the next couple of years where we have a Democratic president, and even after that, the next 4 years after that, when we have a Democratic president.
So Bill Frist has a quick tweet.
Yeah, just a quick thing.
Quick tweet.
The challenges ahead, which is really where we should be thinking, and I'm glad we started with this because now we have 4 days to really talk about the issues. Using Tom's construct, the access issues, Obamacare did a good job there, but we still have 10 million people are covered. Now we still have 20 million people without insurance. We're going to have cost shifting until we have affordable access for them.
Most of
40% of the people who could be subsidized today are enrolled. 60% or about 50% can still be enrolled. So people like the Robert Wood Johnson Foundation, many private foundations, public foundations are together. We've got to get them enrolled in order to make the insurance markets work.
Right.
And so the access issue on the Medicaid side, hopefully removing this fog of uncertainty in the court system will allow our governors and governors and state legislatures to come before and go ahead and expand Medicaid up to 138, 140%. And on the cost side, the payment reforms, which Obamacare in part got going, but the private sector is really working with, ultimately will come down and look at the cost issue as well as the value issue, measuring quality as we come forward. Those are the challenges out there which together, government and the private sector, if we work together in a bipartisan way, we can solve.
Somebody send that transcript down to Bobby Jindal.
But you're beginning to hear, just a cautionary note on costs. And Henry's absolutely right. The Act has administrative authority that's never been there. Huge, shifting the government trillion-dollar government payment system into quality, and they can do it without congressional permission. What Congress is beginning to do under the current leadership is start to flag areas where they're going to stop cost controls. Protecting Medicare Advantage plans. There are 3 or 4 bills in now. Protecting some drug pricing, which is being, so that's one of the things we're going to need to watch is when Congress says, no, you cannot accelerate cost measures based on quality, we're going to protect our constituents.